Hello, everyone. I am so excited to be with you all to discuss a topic that I am incredibly passionate about and I believe really will help to bolster health outcomes as we continue to work on it more and more and advance health equity. I hope that you are enjoying IHA's Health Literacy Conference to this point and you're gaining so much valuable information that you will take back with you to your practice and spread to others. We're going to go ahead and get started. I am Terry McGuire. I am clinically trained as a physician assistant. I've been practicing now for nearly 10 years. I completed my PA training at Duke University. And prior to going to Duke, I went to the University of North Carolina at Greensboro to obtain my Master of Public Health degree in Community Health Education. I completed my undergraduate studies at Wake Forest University. And so throughout all of my schooling and in my professional practice, I certainly see a need in improving health literacy, closing communication gaps between patients and healthcare providers so that we can start to see some improved health outcomes. So today we're going to be talking about personal and organizational health literacy. Let's evolve and shift narratives. So for those of you who like a presentation outline, we're going to start with some definitions. Then we will address some background, the implications of health literacy, what are some barriers to improving health literacy. We will address the medical case, then discuss steps to move forward, and then we will end with some takeaway points. So when we're thinking about health literacy from a personal standpoint, that basically is the degree to which individuals can find, understand, and utilize health information and services to inform their health-related decisions, not only for themselves, but for others. And so I want you to make a note that I italicized the word use because finding and understanding health information is just one part of the equation. You actually need to be able to use that information and how it applies to you in your specific scenario. So I think when talking about sunscreen, it is an easy way to break this down. So individuals may be able to find sunscreen. They may understand that sunscreen helps to protect their skin from the sun. But do you also know that there are different strengths of sunscreen and how often you need to apply it to actually protect your skin? So if you apply it hours ago and you go out into the sun, it may not be as effective. And so being able to utilize the information that you have is quite important. When we're thinking about organizational health literacy, that is the degree to which organizations equitably enable patients to be able to do all of these things. So as a healthcare organization, are you making it very easy for all of your patients that you serve to find, understand, and use information so that they are able to make those well-informed decisions for their health? So when we're thinking about background of health literacy, and we're all here, I'm quite sure, because we know that there is a great need to address health literacy. Our medical system is incredibly complex. It is a lot for patients to navigate, whether you're well or you're navigating an illness. And so some statistics, back in 2003, there was a national assessment of adult literacy. And that adult literacy assessment basically found that 12% of the population is proficient in health literacy skills. And then a little bit over a third of the population have basic or below basic skills. And so this particular assessment broke it down into proficient, intermediate, basic, or below basic. So again, over a third of the population are falling in that basic or below basic skills, and a little over 50% of the population fall into that intermediate level. And so clearly, again, just really highlighting a need to improve health literacy. And this is quite outdated. So we don't know at this point where we currently stand in 2022. But even for those who do fall into that 12% or that intermediate level, that's a baseline. Let's say that they have been faced with a very difficult diagnosis that they are now navigating, or they have a diagnosis that causes compromise of their brain functioning. So then how does that alter their health literacy? And then some more recent assessments in 2017, there was a medical expenditure panel that found that 26.6% of the population reported or those who completed this survey reported that a healthcare provider, that is what HCP stands for, asked them to describe how they will follow instructions. So a little bit over a fourth of the population says that their healthcare provider is actually, asking them to teach back to them, or what they received. So that's actually the teach back method, where a healthcare provider is disseminating information, but then not leaving it there and expecting or assuming that the patient completely understands what was discussed. Actually having that patient repeat and say, how do you understand what we just discussed? And that will allow you to see if there are any holes that the patient may not comprehend or understand, and also just clear up any confusion. And that way that allows for some dialogue and also helps to engage patients. So that is really, really important for improving health literacy, because if you see with this follow-up statistics, 8.9% reported poor communication with a healthcare provider. So a little bit less than 10% said that they are not communicating well with the healthcare provider. So if they're not communicating well with the healthcare provider, a lot is not going to translate from that provider to the patient. And then the last statistic, 52.8% reported that their healthcare provider is always involved in the healthcare decisions as much as they wanted. So over half of those who completed the survey says that healthcare providers are engaging in shared decision making, again, making sure that the patient is an active participant. Because if you're talking to a patient and they're not engaged, they're not able to share how your health recommendations may impact them, may impact their caregivers, then it is really going to impact compliance and if they're actually able to implement the recommendations. Again, to continue with background, we have identified some high-risk populations. So those who have marginalized identities, Black, Hispanic, Native American, Alaska Native, older adults, those who have lower educational or socioeconomic status, those who are uninsured, underinsured, and men have been designated as some populations based on the surveys that may be more at risk for decreased health literacy. So this information is really relevant so that as a provider, you can know which populations may be more at risk. And there is an and. I don't want there to be a misconception that if you don't fall into any of these categories of these populations, if you don't identify with any of these populations, that you automatically have a really great health literacy, because that's not true. And sometimes there can be a misconception with people who are really fluent verbally, so they speak really well, and it can be assumed that they understand based on their verbal fluency. But again, there is relevance to these populations and noting that there may be higher risk, but at the same time, not believing that if you fall outside of these categories, you will understand it all. And we'll talk about the universal precautions approach later in the presentation. So implications, why does health literacy matter? There are a number of reasons why health literacy matters. I told you I'm really, really passionate about that, but we'll talk about some reasons that health literacy matters. So disease prevention. So when we're thinking about disease prevention, we can even think about vital signs. So vital signs are one of the first things that is done at a healthcare appointment for the most part. And so vital signs is really a point that we want to make sure that patients understand, because if we take blood pressure, for example, one of the vital signs, there are two numbers. And those two numbers tell us two different things about what's happening with the body, what's happening with the heart. And so ensuring that, this is not just a parameter that the medical provider needs to be aware of, that the patient fully understands what the implications of their blood pressure are, what the implications of their oxygen saturation are. Especially now, as we're navigating a pandemic dealing with a respiratory virus, oxygen saturation levels have been incredibly important and for us to focus on. Also thinking about vaccinations, again, COVID-19 vaccines, there is, I won't make it past them, there actually is still a lot of confusion around vaccines. When someone is due for vaccines, which vaccines do they want to get? Is it Pfizer? Is it Moderna? Is Is it J&J? And do they qualify for a booster at this time? Then also thinking about screening. So screening things such as a colonoscopy, eye exams, pap smears. One of the stories that I like to tell is to really highlight how screenings help to prevent disease is pap smears. So pap smears are screening exams for cervical cancer. And I had a patient come to me for an unrelated issue, but with all of my patients, I generally like to look through the chart and make sure that they are up to date with all of their healthcare. And so I saw that she had a pap smear. The pap smear was actually abnormal. And based on the recommendations, she didn't follow up at the appropriate time, based on this abnormal screening. And so we had a conversation and she had no idea what HPV is, which is human papillomavirus, and that is a leading cause of cervical cancer. So, I was seeing her for an unrelated issue, but this appointment actually turned around to become about a lot of education for this patient and informing her about human papillomavirus and cervical cancer. Also thinking about better health outcomes. Medication directions are incredibly important. I'm sure many of you have seen prescription labels. They can be quite confusing sometimes. And so, if we're thinking about someone who has been diagnosed with high blood pressure or hypertension, and they have been prescribed medications, do they know how to follow those medication directions? Because if they don't and their blood pressure is not adequately controlled, then that could reduce optimal health outcomes. And then also, do patients understand what's the timing of their follow-up? So as I was mentioning with the cervical cancer screening, if it comes back abnormal, there is a window of time that you want to follow up so we can repeat that exam and determine if it's still abnormal or if we need to do additional intervention. Reducing morbidity and mortality. So continuing along the lines of high blood pressure. If someone has been diagnosed with high blood pressure and perhaps they don't understand their medications, and so they're not taking them appropriately, and their blood pressure is out of whack. And maybe they haven't followed up because they don't know what is too high, and potentially they're not having symptoms, but then it results in a myocardial infarction or a cerebrovascular accident. And I was intentional about using those medical words because they're quite large, but they don't really make sense to a lot of people unless you're in healthcare. So those big words just basically mean high blood pressure could potentially lead to a heart attack or a stroke. And so again, really just, kind of embedding how health literacy and how confusion can happen in patient exchanges if we're not careful and mindful of the language and terminology that we use. But again, if someone understands what a vital sign means as it relates to their blood pressure, what's normal and where should their blood pressure be, and if they're able to understand those directions and how to keep that blood pressure under control, then hopefully we can reduce morbidity and mortality with the prevention of heart attacks and strokes. Lowering healthcare costs are really, really important. So if patients are not well informed or they're not understanding, then it results in a lot of bounce back to ER visits. And so ER visits can sometimes result in rehospitalizations to manage the patient and to get things back under control as it relates to their chronic disease. And so, of course, ER visits, being in the hospital is incredibly expensive. So you have a lot of copays and deductibles as it relates to some issues that, potentially could have been addressed as far as this helping patients understand. And then lastly, advancing health equity. We want to make sure that we are providing culturally appropriate care to patients, and we're engaging the patients in their care so that we can close communication gaps and address all of these areas so that we can really start to make a difference as it relates to health equity and health outcomes for people with marginalized identities. So what are some barriers? So, improving health literacy sounds really, really great, but what are some barriers to doing so? So for patients, it may be time. So do patients have time to come into their appointments to follow up adequately as we discussed before? Is the patient really overwhelmed at home? Are they a caretaker for someone else? Are there some social ills contributing to them coming into their appointment? Transportation. Are they having difficulty finding transportation? Is it that they found transportation, but they get to their appointment late, and so now a 30-minute appointment is now 10 minutes, and so it's very hard to cover all of the information in a shortened visit, as could be if it was, longer, if the patient was able to get there on time. So lack of engagement is really, really important. So it's incredibly vital for patients to feel that they are a part of their care, that they're actively engaged, they are able to communicate well with their providers, they feel seen and they feel heard, because sometimes intimidation prevents patients from asking questions. They don't feel comfortable and they feel very ashamed if they don't know which questions to ask. Sometimes I hear people say, I get a lot of health information at once and I really don't know where to start and which questions to ask. And so sometimes as a provider, if a patient says they don't have any questions at that moment, it doesn't mean that they're not engaged or they don't want to understand. It may just take them some time to really process the information or to think through what questions they may actually have once they've processed all of the information. And so for healthcare providers, again, time is a barrier. So I'm sure all of you have been to an appointment and it was running behind because the provider, had a lot of issues to address with other patients. And sometimes those visits can be very, very short. And, there are studies that say a lot of chronic disease management actually happens outside of the healthcare appointments because it's quite impossible to cover everything in one appointment. And sometimes that's why patients have to do frequent follow-up to make sure that all of the information can be addressed. Lack of cultural competency, training, resources. And so again, as patients feel engaged, if they feel that they are seen and they're being heard, is really, really vital. So I really encourage providers, just as we do continuing medical education, to really start to educate yourselves as it relates to various cultures. What are some triggers for different cultures so that you can show up best for different patients? Also, training is really, really important. It's vital that healthcare organizations and institutions really invest into training, because health literacy is a learned skill. There's not a large focus on health literacy inside a medical training program. So making sure that healthcare providers have that continuing training so that they can be abreast on any new research that has been released, and really learning how to best communicate to patients. And then also resources. So I've worked in a rural health clinic before, and oftentimes patients would come in with very, very complex health conditions, but I did not have the luxury of being able to send them to a specialist within, before 2 to 3 months sometimes. And so sometimes if healthcare providers are working in an under-resourced healthcare institution, then it can be really hard to be able to direct patients to patient care navigators so that they can have additional education, diabetes educators, and people who are actually there, a patient advocate, to help really hone in onto what areas patients may be having as it relates to misunderstanding. And then bias. Sometimes patients or people really get defensive. I'm not biased, but, if we're honest, we all have bias because we're socialized. We live in a society where there are systems and institutions in place that, really assign a lot of negative connotation or attributes to certain populations. And so, over time, we begin to take that in. And so just being mindful of our bias as healthcare providers so that it does not influence or negatively impact how we are communicating with our patients. So again, just, bias if someone is really verbal fluent and feeling like, oh, this patient understands, they don't fit into any of those other categories, so I don't have to break it down for them. Or because this patient is not asking me questions, they're not engaged with their care, so they're not going to do what I'm recommending anyway. So again, just really being mindful of how we think about our patients and what types of things are influenced by society. And lastly, healthcare organizations may have barriers because they're competing priorities, and what those healthcare organizations find is most important for best addressing the patients that they serve are their budgetary constraints. So is it hard for healthcare provide or healthcare organizations to bring in folks who are really well versed in health literacy to train the staff? And then we have medical racism. So we really do have to name and be very honest about how medical racism still plays a part in how we deliver healthcare today. So, even recently how the measures for creatinine was recently updated to take away race as a factor in determining someone's kidney function. Also, medical racism and just looking at the number of healthcare providers of color. So it's really important that patients can see themselves sometimes in the healthcare providers and have healthcare providers that look like them. And so if we're not really recruiting providers of color, that can really be a barrier and a problem for advancing and increasing health literacy. And then lastly, resistance to culture change. So, it can be really hard for organizations to shift and to change. And, again, because time is a big issue, how do you implement in your practice now to try to best reach patients with taking more time and learning better ways to communicate with patients? How is that going to impact your culture? Is it going to be an issue with revenue? So again, just thinking through these things, being honest about some of these barriers and how we can really start to turn the tide. So here's a medical case. So a triage note, this is what the nurse wrote for the provider, says a 39-year-old cisgender Black woman patient presents for a physical exam, which will use PE moving forward after her mother was diagnosed with ovarian cancer. So once the patient sees the provider, she says, my last physical exam was 5 years ago, so I need all of the tests. And the healthcare provider is already feeling a little bit antsy and feeling the pressure of running behind schedule with other patients waiting, and says, I'm sorry to hear about your mom, but the physical exam today will only include the actual exam. I'm going to listen to your heart and your lungs and check and make sure things are okay. We'll do the pap smear for screening purposes of cervical cancer, and then we'll do some baseline blood work. So we'll check your blood counts, we'll check your liver, your kidney function, all of these things that are included in a general physical exam. The patient, why can't you do more today? I need to know if I have cancer. So this is, a scenario that can actually happen in a patient encounter between, with a provider. And there is a lot of education that's needed in this particular encounter, but for the most part, physical exams, are limited to the exam, some preventive care, and really not, delving too deeply into the specifics, depending on the provider, depending on the culture of the healthcare organization. And not to, say which way is right or wrong. I do think that there is room for really expanding how we, do our physical exams. But, specifically as it relates to ovarian cancer, there's not a lot of really good tools to screen for ovarian cancer. And then also really having the time to discuss potential symptoms that the patient has had. If the mom has had any genetic screening to see if that has, related to the ovarian cancer in any way. So, in these particular situations where patients come in and there are a lot of questions, so, it's really difficult, especially with this patient, because there was no follow-up in 5 years. So we are not sure why the patient, based on this scenario, why the patient hasn't been seen in 5 years. But research has also shown that patients who are lost to follow-up may have some issues with health literacy because they don't fully understand, provided, there are no other extenuating circumstances that may explain why the patient was not seen, but understand like preventive care and how, certain screenings need to be done on an annual basis, or if there are any health conditions, maybe more regular than that. So, in this particular situation, in addition to what the provider said, it would be helpful to, just to say, we are not able to address specifics related to the ovarian cancer, but I would love to discuss this with you because I want to talk to you about, some next steps. So at least allowing that patient to know that they are able to follow up and really delve deeper into like the screening. If an ultrasound can be a next step if the patient potentially has symptoms, and just ways to move forward. Again, you want to keep that patient engaged. It has been 5 years, but hopefully just really giving them a point to take home and know that they can come back to continue their care and help to calm down some of their anxiety. And as we think about moving forward, I like this three-pronged approach because there are some pointers for patients, healthcare providers, as well as healthcare organizations to implement to be better so that we can evolve and shift narratives as it relates to health literacy. So patients, seeking culturally competent providers is incredibly important. So providers that look like you, or if they do not look like you, are able to speak your language. They're very well versed with cultural issues, cultural nuances that influence how you show up as a patient, how you respond to health information. And then it's helpful to establish relationship with an open mind. And I say that because a lot of patients, specifically patients with marginalized identities, have had a lot of trauma in healthcare settings. And so sometimes establishing care with a new provider is incredibly hard. And so I do try to encourage patients to do it with an open mind, and then discussing those needs and triggers and boundaries that really resonate with you. And so that way that you don't have to move forward and potentially re-expose yourself to more trauma in a healthcare setting. Feeling empowered to ask questions is really important, because a lot of times patients do not feel that they're smart enough, or if their question is actually valid. But I really encourage patients that any question that you have, really feel empowered to ask that question, or to bring someone along with you in your healthcare appointment. So if you don't know questions to ask, someone else that's there with you can ask questions on your behalf. Take notes and follow up as needed. Often there is a lot of information that can come up in an appointment. So making sure that you're taking notes, jotting down things so that you don't forget. You can revisit those things later and then follow up as needed, especially with the Cures Act. So basically patients now have access to about 8 different types of clinical visits and the after visit summary, the AVS. And so if you don't remember everything, you can actually review these after visit summaries to see, oh, this is what was discussed, this is what was recommended. And you can also use the portal so that you can go in and type messages to your provider to follow up if you think of questions later, or if there are things that you want to follow up on. Send your blood pressure readings, and don't send your blood pressure readings if they're elevated. The portal is really utilized for non-emergent issues, because sometimes they may not be answered in 24, 48, or 72 hours. And so making sure that you're not asking about emergent questions in that portal, but knowing that it is a resource for you to supplement whatever information that came up in the visit that needs a little bit more time to kind of work through. Using reputable sources when researching is really important. So, I actually think it's helpful for patients to look online, but you just want to be mindful of what sources you're using. So just making, not just Googling anything, because it can take you anywhere, trying to be specific in what source you use. So Mayo Clinic is a good source to use, or if there are any local resources that maybe culturally specific are really good. Like there are a number locally and national resources that patients can utilize to get more information about things, diabetes, high blood pressure, pap smear. So any number of health conditions, you can certainly find more information online, or ask your healthcare provider, which resources do you recommend that I use? If there's like myplate.gov if you're trying to work on your diet. And then also, and we talked about already, reusing the resources to complement your care. So again, those online resources, but then also, are there any other resources being offered to you? Sometimes insurance companies have patient care navigators that will call you if you have asthma or if you have diabetes, to make sure that your management is optimal. And then moving on to healthcare providers. So we talked briefly about this, but checking biases and ego at the door. And so, providers are well trained, on an academic level, but that doesn't mean that every patient will or every patient is the same. And so you have to really be mindful of how you show up for those patients and then not relying so much on academic medicine where you begin to treat conditions and treating the patient becomes secondary. Establishing relationship and acknowledging patients' vulnerability. So as we mentioned, there's a lot of medical trauma for some patients, and even if there's not medical trauma, it's a lot for patients to come into appointments. It's a very vulnerable place to be in, especially if they've been diagnosed with something that really has swept them off their feet. It's really hard to open up to a stranger about their healthcare. So just being mindful and very sensitive around that. And so I alluded to this earlier, seeing patient as primary and the health condition secondary. So it's not a one size fits all. Every patient is different. Every patient that comes into your room is different. They have a different set of circumstances. They have a different set of experiences. And so you do have to tweak your care to really be able to connect with that patient and ensure that the information that is being provided will be received as best as possible. Taking time, I know this is hard. It's truly a barrier to healthcare, but as much as possible, taking the additional time and using curiosity-driven language. So curiosity-driven language is asking questions, asking honest questions of patients, using open-ended questions. And so not just those questions that result in a yes or no, but asking questions that allow the patient to engage so they can feel seen and heard and comfortable actually divulging information, again, in this very vulnerable place. Practice shared decision making. We talked about this before, making sure that patients are actively participating in their care to help increase compliance. Welcome questions and ensure understanding. So, really trying not to run in and run out. Patients really pick up on that. And sitting, welcoming questions, ensuring understanding. And then lastly, addressing personal and cross-cultural miscues. So whatever areas you feel weak in, as it relates to different cultures, look into some resources that can help you to be a better healthcare provider in really reaching all of the patients that you serve. And then healthcare organizations, really identifying health literacy as a priority. So there is a great need to improve health literacy, and it has to be a priority in the services that you deliver to patients. So we're thinking about organizational health literacy. Are you equitably enabling patients to use, to find, understand, and use health information? So it has to be a priority, whether that's in how providers are communicating, in your documentation that patients have to sign, in signage that patients see. And then once you have developed your health literacy initiatives, review those regularly. They may be on every 6-month review or an annual review, but I don't think going over an annual review is really optimal. Providing health literacy and training for healthcare providers and staff is really important, to include components of health literacy to ensure that providers are really understanding how to best communicate with patients so we can close communication gaps as best as possible. And then evaluate your interventions that you've had. So if you had trainings, evaluate how those are going. Also evaluate those initiatives. Use a universal precautions approach. So again, not looking at people and assuming that they understand what you're saying based on how they identify or how verbally fluent they are. And so just how we have universal precautions for bloodborne pathogens, and we, see everyone as potentially having a communicable disease. And so we, wear our gloves, especially now during COVID, and wearing our masks, because you can't look at someone and say, if they have COVID or not, and you're trying to protect yourself. So in the same way, we want to ensure that we're seeing patients all the same and not assuming that someone will not or will understand based on how they show up. So really just saying that all patients have the potential to misunderstand or misinterpret health information, again, because even if you are proficient in a general literacy assessment, that may not translate to health literacy specifically. And again, if you are proficient within health literacy, if you are compromised, if your health is compromised, that could certainly reduce your literacy. And then ultimately, or using a health equity lens, it is incredibly important that whatever initiatives are implemented, that it has a health equity focus. And then investing in quality improvement. So how can we do what we do better as it relates to health literacy? Also moving forward, as I mentioned, the health literacy assessment that we still really utilize today as far as percentages are concerned, we need updated and reliable baselines to know where we stand in the United States currently, so that as we are doing all of this work to improve health literacy, we can see how much traction we are gaining, how much improvement we have made. We can also look to Healthy People 2030 for guidance. They're currently working on 6 objectives to address as it relates to health literacy, and not only healthy people, but other resources that release information for both patients and healthcare organizations for improving health literacy. So in summary, these are some takeaway points that I think are very, very important. And so we've had a lot of racial tension recently as it relates to police brutality, and there has been a trend for a lot of healthcare organizations to release statements that condemn racism and injustice and promise commitment to the work of health equity. I do not think that we can have conversations honestly about health equity without also addressing health literacy. And if we really want to move the needle towards improving health outcomes for vulnerable populations, we must always, always keep vulnerable populations the central focus during the planning and implementation process of any health literacy objective. These are references that I use. I have thoroughly enjoyed talking to you all about personal and organizational health literacy in ways that we can really evolve and shift the narrative. I welcome questions. I would love to engage with you all, continue this conversation. So please, please reach out to me if you have any follow-up questions. My website is evolvehealthandwellnesscommunity.com. Feel free to go there and submit an inquiry, or you can email me directly at evolvehealthandwellness222@gmail.com. Thank you all so much for your time, for your attention. I hope you enjoy the rest of the conference. And as I say at Evolve, in love and evolution always, take good care.